Kate Cahill speaking out on behalf of those who can't.
Because the amount of judgment that I had got to try and get to that point was ridiculous.
Last year, Kate unexpectedly fell pregnant. She chose to have a medical abortion, so her GP prescribed MS two-step. It's rare for medical abortions to fail, but hers did. And more than 3 months later, she was back at the GP's office, now 20 weeks pregnant.
He shook his head and said, you've got yourself into a predicament. Then went on to tell me, this is your miracle baby. You need to have this baby.
Kate didn't feel she could care for a child, but getting an abortion at her gestation proved difficult because the nearby public hospital in Orange had stopped providing abortions for unwanted pregnancies.
The easiest option, as far as the system was concerned, was for me to have that baby.
She and her GP tried multiple hospitals and clinics, but with no luck. Kate was eventually admitted at Nepean, a 4.5-hour drive away. She had to go through counselling, arrange a birth and death certificate, then be induced and go through a painful labour. She gave birth to the fetus 4 days shy of the legal deadline.
I feel like a monster.
Access has improved in some jurisdictions, but many say abortion stigma remains embedded in the health system.
The people in positions of power in states and territories in the health system will dictate whether abortion is provided or not.
The ABC has spoken to clinicians right across the country who've witnessed health workers and professionals, as well as hospital managers and executives, restricting abortion access. Advocates argue that what happened to Kate is just one example of how decisions made at the very top trickle down the health system, affecting those working in it and the people seeking treatment.
They are single mothers, they are migrant and refugees, people with disability, they're Aboriginal and Torres Strait Islander people.
Often it's the most vulnerable who need time-critical care. Lucy Barber, ABC News.